liver has an incredible regenerative ability to allow us to keep living and being able to respond to injuries or to surgeries, which may remove part of it and allow it to reconstitute and perform its incredibly important functions for us.
So liver has many functions, such as metabolizing toxins and produce proteins and coagulation factors. So liver is a powerhouse of a biochemical function in the body.
So chronic liver disease is the result of an ongoing damage and inflammation to the liver and an ongoing attempt to repair. This continuous repair rather than resolution ends up in the scarring of the liver and the regeneration among the scarring. This ultimately results in liver cirrhosis.
We will eventually be able to find other pathways where we can accelerate the mechanisms of repair to remove some of that scar and allow the restitution of function within the liver. But sometimes it crosses a boundary.
When the liver progresses to end-stage liver disease, liver transplant is the ultimate treatment options.
Liver transplantation has really developed incredibly from the 1970s on, and is now actually part of our standard armamentarium for treating patients either with severe acute liver failure or more commonly for the treatment of patients with chronic liver disease.
We remove diseased liver and replacing with either from deceased donor or living donor liver.
And that liver will regenerate in that individual to its same size, and then that segment that's removed from the donor can be placed into the recipient and itself will regenerate and restore normal size, normal function of the liver.
The goal is the people who doesn't have a good access to a deceased donor to have more transplant opportunity. Somebody who is a very sick patient, deceased donor would be appropriate. And somebody who is not sick enough, does not have a good opportunity to have a deceased donor, living donor has a very viable option.
We have such a dear organ shortage, and this is being worked on by trying to find ways of using other donor organs that might not have been able to be used before.
So we incorporated new technology. It is called normothermic machine perfusion, which keeps the liver warm and also more viable. Using this technology, we can check liver function and also improve donor use.
Transplant is feasible because of basic research in immunology, because of basic research in how the liver reacts, because of a lot of research how do we transplant more liver that otherwise they would be discarded. But on the other hand, we learn from the transplant, and we learn from studying the explants.
So here at Yale, we have a number of different groups that are involved in very excellent research and translational research.
The mission of the Liver Center is actually to find better treatment for liver disease, and we do that by improving the knowledge of the pathophysiology of the liver. We have three main themes. So one is inflammation, the other is metabolism, and the other is epithelial liver cell biology. But the intersection of these three then is relevant for basically all kinds of liver diseases.
There will be in the future therapies that will be able to interrupt the natural history of the disease otherwise and prevent the progression of disease, and some of these patients may never need a transplant. And so this is the wonderful nature of being involved in these major advancements and disruptors that have actually changed the natural course of disease. So it's a great time, but we need to do more still.